International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Thank you so much for the opportunity to talk to our editorial on achieving integrated care for older people. And all four of us who were involved in writing the editorial are going to participate in the podcast today. And you'll see as we swap places, myself, Gill, Joe, Amy and Manasi, all colleagues working together at the University of Adelaide. And we titled the editorial, Achieving Integrated Care for Older People, Shuffling the Deckchairs or Making the System Watertight for the Future. And it's really an analogy from the ship, the Titanic, very famous story, but it's a phrase people often use when efforts are made in the face of an impending disaster, just fiddling with things rather than dealing with the source of the problem and preventing the ship going down. And we wanted to look at this in relation to the editorial, really to reflect on what's been happening and what is happening to improve integrated care for older people and where we are now, what we've learned and what we need to do in the future. It's been the subject of numerous policy initiatives in most countries, most high-income countries, undertaking work to improve integration of care for older people. And yet some of the research, some very recent research, would suggest that we've still not got it right, that there are some really good examples locally of people improving integration across care providers, across services, but that there's still a gap between the policy ambition and the day-to-day experience of people who live in local communities.
So, in this paper, we try and canvass the whole of the question. We look at the nature of the problem of caring for older people who often have very complex needs and span all areas of the healthcare system. We look at some of the solutions that have been tried and tested, and as Gill has said, some of the pros and cons of those. In particular, we focus on lessons from previous initiatives and the research that's been conducted around that. And then at a very practical level, we try and explore how we could apply some of this learning to make our metaphorical ship more watertight in the future. The problem that we're particularly looking at is what's often described as a wicked problem, and that is older people are much more likely to experience fragmented care, have high rates of multi-morbidity, and are in much of the world increasing in number. We know that this population typically sees more doctors, they take multiple medications, they have numerous agencies involved in their care, and they experience more emergency department presentations and hospitalisations. Transitions of care, such as admission to hospital or discharge from hospital to home, are particular stress points for both the older people and for the healthcare system, and it's a time when communication and coordination often breaks down. A great illustration of this process is Sam's story, which was created by the King's Fund and which we'll play for you now.
Over the next 20 years, the number of over 85s in the UK will more than double, meaning many more of us with multiple long-term health conditions. Our current health and social care system won't cope. Fundamentally, it's the same system as when the NHS was set up, designed to treat episodes of illness one at a time. Already we're failing to give vulnerable people the care they need, and we're set to run out of money fast. Meet Sam. He's 87 and suffers from emphysema, a disease that makes it hard to breathe, and also has type 2 diabetes and arthritis. Sam was coping pretty well until his wife passed away, but is now lonely and increasingly depressed. Sam frequently visits his GP, but finds it difficult to discuss all his needs in a brief consultation. If Sam can't get hold of his GP in a crisis, he calls for an ambulance. Each time, Sam spends time in A&E and is often transferred to a ward as well. He sees lots of different healthcare professionals and has to explain his conditions repeatedly. Frustrating. And Sam often has to wait to be assessed by social services before he can go home. The result? A lot of unnecessary time in hospital. And when he gets home, a lack of coordination between his GP and social care often means he doesn't get the support he needs. Eventually, after several hospital visits in just 6 months, it's decided to admit Sam to a care home. But what if Sam's health and social care services were more joined up? Let's imagine one of Sam's carers is given overall responsibility for coordinating his care. For example, Kathy, a district nurse. Kathy meets with Sam, his GP and his social worker. Sam explains that he wants to manage his conditions at home, and together they design a care plan which they can all access online anytime. Sam now gets more visits from Kathy at home, which helps him manage his emphysema and diabetes. On the occasions when he does have a crisis, Sam calls Kathy rather than an ambulance, so goes to hospital less frequently. And even when he is admitted, he's discharged after a quick review of his care plan rather than having to be reassessed. In this scenario, Sam's health and social care is funded from a joint budget, so the team can make smart decisions about how it's spent and call on the help of other social services. For example, as his condition deteriorates, the team decide to fit a seat in Sam's shower, provide him with an oxygen cylinder to ease his breathing, as well as a medication dispenser with a voice prompt to remind him to take his pills. Kathy talks to Sam about his loneliness, and he agrees to weekly trips to the shops with a volunteer from a local befriending charity. So now, Sam doesn't have to be admitted to a care home, instead getting the help he needs in his home. He feels happier, is healthier, and better use has been made of resources within the system. Let's recap on what transformed Sam's care. Put simply, local leaders in the NHS, social services and the voluntary sector created a shared vision of what good integrated care looked like, centred around the needs of people like Sam and their carers. They pooled resources across health and social care, built multi-professional teams and created systems to allow Sam's information to be easily shared. Sound idealistic? Well, this is actually already happening in a few places. Now it's time to make sure it happens everywhere. Let's reimagine how we provide care. Get inspired at kingsfund.org.uk/joined-up-care.
So this raises some logical questions that if integrated or joined-up care is so beneficial at individual and societal level, why we have not already implemented it? There are manifold issues as we have highlighted in our editorial, some of which are that different healthcare practitioners or different parts of healthcare system are governed by different political and management organizations. So there's always an issue of bringing all of them together. Coordinating care between different healthcare professionals is always challenging. Even healthcare IT system which is used is often fragmented, and to collect data under one place is also another challenge. So there's no real one-size-fits-all solution. What we have alluded to in our editorial is that future research should focus on bringing in a whole person approach or a holistic approach, take into consideration what are the patient's perspectives, what they want, and involve all stakeholders influenced or affected and involved in providing integrated care into the whole process of building up a profile tailored to the population in concern.
So how can we make progress and move forward and improve integrated care? First, we need to pay close attention to the processes of implementation. We need to develop tailored, locally relevant, bottom-up approaches. We need to engage people, so we need to listen to patients and their families and adopt a holistic view that embraces health, functional and social issues. This includes involving everyone who's part of the problem and the solution. So we're having a system-wide view instead of looking at certain sectors. And lastly, using more engaged approaches such as co-production to support the development and implementation of integrated care for older people. So we hope you found this editorial and this podcast useful, and we'd like to acknowledge the Hospital Research Foundation, who have funded our research in improving integrated care for older people. We'd like to acknowledge our research partner, COTA SA, and also the many different stakeholder organisations that are involved with our research in improving integrated care. And lastly, acknowledge the older people who have agreed to participate in our ongoing research around integrated care.